Hello guys and welcome back to my channel. My name is Tommy. I am a human nutrition student and researcher at the university. What I do in this type of videos is to synthesize my classes so then I can explain and teach you the best and most valuable information you need to know. Today we're going to continue the pharmacology series of videos and we're going to take a look at the respiratory drugs. So let's begin. Interactions in respiratory system pathologies. These are the main reason for first consultations in primary medicine, and they are the third leading cause of death in Europe. We're going to see three things related to this. So let's start with COG. COGing is a reflex action with a protective function. It can be productive where there is expectoration without treatment, it's not needed. Non-productive or dry, when there is no expectoration but requires treatment. It can be acute or chronic if it lasts more than 10 days. Is initiated by irritant stimuli carried by the vagus nerve, also known as pneumogastric, and it has vagal sensory fibers, which are the fast adapting receptors, the capsaicin sensitive fibers, and the bronchopulmonary afferent C fibers. They indeed are related to the COG reflex. And from this fiber there is an integration in the COG center in the medulla oblongata, which is independent of the respiratory center. The COG center afferent pathways will create a muscle response and therefore initiating the act of coughing, which has three phases: the inhalation, the increase of intrathoracic pressure, and then the expulsion. So now let's take a look at the antitussive drugs, starting with the opioid antitussives. We have the codeine, the dextromethorphan, and the noscapine. The codeine depresses the medullary COG center by inhibiting the production of tachykinins, the main neurotransmitters of the C fibers. They are taken orally with or without food, and if they are a syrup, you can take it directly or dissolved in another liquid. Not prescribed in COPD or severe asthma, and it causes respiratory depression, so not acting only in the COG center, but also affecting the respiratory center. Very important. It is not prescribed in pregnancy because it may give the neonatal abstinence syndrome, and this is a reason why it is a FDA category C, so not really safe. It may give nausea, vomiting, constipation, and the interaction with alcohol increases its effect, as in every opioid antitussive. Then the dextromethorphan, which is a codeine analog, so guess what? It's going to do the same thing. Depresses the medullary COG center, inhibiting the tachykinins, which are the C fiber neurotransmitters. It is rapidly absorbed orally with or without food, and better to avoid the grapefruit juice or bitter oranges because of the cytochrome P450. Not prescribed in asthma or COPD, neither in children or lactation. It may give dizziness, drowsiness, nausea, vomiting, intestinal discomfort, and fatigue. It lacks the narcotic effects, so it differs from codeine, and the alcohol and grapefruit juice will increase its effect. Again, alcohol as in every one of them. And then the noscapine. Guess what is the mechanism of action? It depresses the medullary COG center, inhibiting the tachykinins, which are the C fiber neurotransmitters. It is taken orally or as a suppository, when orally, preferably after the meals. Not prescribed in the respiratory depressant, and not when there is a low mucociliary clearance, as well as when there is a low bronchial secretion, because it is a bronchodilator. You can prescribe it in children from 2 years of age, and better not in pregnancy and lactation. It causes nausea, headaches, and drowsiness. And as the others, it interacts with alcohol, increasing its effect. Then we have the non-opioid antitussives, clopidogrel and levodopa. The clopidogrel is a possible depression of the COG center plus a bronchodilation and a local anesthesia in the bronchi. It says possible because the mechanism of action is not well known. It says possible because they don't know exactly what is the mechanism of action. They suggest that it can be this one. Syrup, oral suspension, shake before the use, and can be taken with or without food. It does not result in dependence or nervous depression, like the opioids. You can prescribe it in children from 2 years of age, and it has anticholinergic effects. So be careful in children as they are more sensitive. The levodopa has an interference in the release of sensory neuropeptides in the respiratory tract. So what it does, it's inhibiting the capsaicin-induced COG. If you remember, the capsaicin is one of the vagal sensory fibers. It is taken orally and 3 doses when fasting, and space them at least 6 hours apart. It has greater effects than the clopidogrel if the COG is induced by peripheral stimuli, but it has 10 times less effectiveness than codeine when the COG is from a central region. It may cause nausea, vomiting, diarrhea, abdominal pain, gastric hyperacidity, dyspepsia, somnolence and headaches, vertigo and palpitations. And then all the antitussives. The mepyramide, it is axanthin and it acts as a non-specific H1 antihistamine. It produces a slight bronchodilator effect as well. Taken orally with food, not in porphyria, and it may cause nausea, vomiting, constipation, diarrhea, epigastric pain, anorexia and dry mouth. These symptoms decrease if taken with food. That's why it is very important. And with alcohol there is drowsiness. Then the ipratropium bromide. It is a bronchodilator and antisecretory. And it is also a COG reflex impulse blocker. It is inhaled and it may cause nausea, dry mouth and dyspepsia. And then the diphenhydramine. It is a central COG suppressant, mainly, and also has some H1 antihistamine effect. It is taken with sufficient liquid, with or without food, and before going to bed, so at night. It may cause dry mucous membranes and the thickening of the mucus. And with alcohol, it produces drowsiness. So now let's take a look at mucus. Mucus is produced by goblet cells, which release the MUC5AC, and the submucosal gland cells, which release the MUC5B. So you can see here the submucosal glands and the goblet cells. The purpose of the mucus is to protect the tracheal mucosa, and the mature glycoproteins or mucins will increase the molecular weight, so forming the gel-like mucus. The viscosity can be increased also when there is the presence of high amounts of DNA. And the mechanisms in charge of the mucus drainage are the ciliary activity and cogging. What are the drugs for the mucus? We have the expectorants, such as the eucalyptus and the menthol, which are essential oils of the terpenes group. Also the iodides, potassium iodide for example. It increases the aqueous secretion of the submucosal glands by direct action or by activation of the gastropulmonary vagal reflex. The potassium iodide can give gastrointestinal discomfort, rhinorrhea, iodism and thyroid alterations because of iodine. And then the guaifenesin. The guaifenesin is a guaiacol glyceryl ether. It stimulates the production of bronchial secretion by reflex mechanism of irritation of the gastric mucosa. It is taken orally and as a syrup, directly and then a glass of water. It can be taken with or without food, not in porphyria and not in children under 2 years of age. The adverse effects it may have are nausea, vomiting, diarrhea, drowsiness, dizziness and headaches. Then we have the mucolytics. So instead of promoting the mucus excretion, we try to lower the viscosity of it. Starting with the thiol derivatives, we have the acylcysteine and the carbocysteine. The acylcysteine breaks the disulfide bridges, reducing mucus viscosity, and it has a maximum effect at pH 7 to 9. It is taken orally, best with food, and especially in the morning. It reduces the mucus hyperviscosity in common cold and flu. Not prescribed in hypersensitivity, and caution in children. Be careful with that. It may cause nausea, vomiting, diarrhea and gastric hyperacidity. The carbocysteine increases the synthesis of sialomucins, so they re-establish the normal composition of the mucus, normalizing the mucus viscoelasticity. It is taken orally with a maximum dose of 600 milligrams once a day. We take it with a glass of water after each dose and plenty of water during the day. Not in peptic ulcer, because it may worsen the situation, and not in children under 2 years of age. It may give nausea, vomiting, dyspepsia and abdominal pain. So similar to the acetylcysteine indeed. Then the vasicine derivatives. We have the bromhexidine and the ambroxol. With the bromhexidine there is an activation of sialyl transferase responsible for synthesizing sialomucins, as in the carbocysteine for example. And this will give a normalization of the mucus composition. There is also an activation of lysozyme, which induces the breakdown of mucopolysaccharides. How to take it? Orally, with an inhalation or injectable. Glass of water after each dose and plenty of water during the day. It reduces the mucus hyperviscosity in common cold and flu and not in hypersensitivity, caution with children. It may cause nausea, vomiting, diarrhea and abdominal pain. Then the ambroxol. It increases the synthesis of sialomucins and it normalizes the mucus composition. There is also an increase in lysozyme, which promotes the breakdown of mucopolysaccharides and the stimulation of mucociliary activity. Taken orally, it reduces the mucus hyperviscosity in common cold and flu, not in children under 2 years of age, and it may cause nausea, dysgeusia and hypoesthesia. Then we have some enzymes, the dornase alpha and the streptodornase. The dornase alpha, it acts as a degradation of DNA molecules from neutrophil lysis, the cause of mucus hyperviscosity. Inhalation, it is prescribed for cystic fibrosis in patients with a treatment over 5 years, not in hypersensitivity. It may cause hoarseness and pharyngitis, rash with urticaria and conjunctivitis, and possible chest pain. The streptodornase is a deoxyribonuclease that produces an enzymatic degradation of suppurative and viscous exudates. The way of taking it is nebulization. It is indicated in very specific cases and only for a few days. It can cause bronchospasms and hypersensitivity reactions of varying severity. It has a highly variable efficacy and low yield. And now let's take a look at asthma. Asthma is a chronic inflammatory disease with bronchial hyperresponsiveness and variable airflow obstruction, so inflammation and hyperresponsiveness mainly. The goal of the treatment is to achieve and maintain the control of the pathology and also to prevent the future risks. The prevalence is that it is increasing and it is most common in middle age and women. Many risk factors are involved, as you can see here. The triggers are inflammatory factors, irritants, and as well as others. What it happens in the asthma is that there is an exaggerated contraction of bronchial smooth muscle, hyperresponsiveness, to allergens causing mast cells degranulation. And also the inflammatory mediators will increase the inflammatory reaction in the bronchi, creating a damage and further hyperresponsiveness. So it's a cycle. The symptoms are coughing, wheezing, dyspnea and chest tightness. Here we have to differentiate two things: the forced expiratory volume in the first second and the forced vital capacity. And the ratio between the two in the asthma is below 0.7. Of course, everything is based on the severity of the asthma, and we're going to adjust the treatment based on that. So let's take a look at the drugs. We have the bronchodilators for immediate phase response and the anti-inflammatories for the late phase response. Bronchodilators first. We have the beta-2 adrenergic agonists. Here we have the salbutamol for the short action and the salmeterol for the long action. They are taken by inhalation. The short acting on demand, 3 hours of action, and the long acting twice daily because they have 12 hours of action for asthma and chronic obstructive pulmonary disease, and they can give mild tremor, tachycardia or hypokalemia after high doses. Be careful in hyperthyroidism, cardiovascular disease or arrhythmias. Then we have the anticholinergics, the ipratropium bromide for the short action and the tiotropium for the long action. They block the muscarinic receptors M3, which respond to the parasympathetic bronchoconstrictor tone. These are taken by inhalation and not in glaucoma, prostatic hypertrophy and pregnancy. They can cause dry mouth and the systemic effects are rare. And then the xanthines. We have the thiophelin here, which inhibits the phosphodiesterase by increasing the cyclic AMP. This will indeed create a relaxation of the smooth muscle and a bronchodilation. It also acts as an anti-inflammatory. It is taken orally, not in heart disease, and it may cause digestive problems because it is taken orally, nausea, vomiting, tremor, insomnia and tachycardia. It interacts with tobacco, lowering the effect of the thiophelin. So tobacco, lower effect. And the anti-inflammatories now, we have the leukotriene receptor antagonists. Here we have the montelukast, which inhibits the effect of the endogenous leukotrienes and produces bronchodilation. Taken orally, and it may cause inflammation of blood vessels, nausea, vomiting, abdominal pain and diarrhea. It interacts with orange juice by lowering its bioavailability and efficacy. And then glucocorticoids. The main one is the budesonide, which reduces the mucosal inflammatory response and reduces the bronchial hyperresponsiveness. So both. It is an inhaler and it can also be taken orally or intravenously, but only in severe chronic asthma. It is the more potent and more effective treatment of them all, and it may give oral or pharyngeal candida, cog and pharyngitis. It interacts with grapefruit juice because of the cytochrome P450, increasing the effect of the drug, with alcohol, creating ulcers, with calcium that must be supplemented in the diet, because as being a corticoid, will indeed promote the osteoclast activity, removing calcium from the bone. The echinacea will lower the effect, the licorice will increase the effect, and the tobacco will lower the effect of the glucocorticoids. Okay, this is it for this video. I hope you understood everything I said. If you didn't, there is a comment section down below. Remember to download this diagram by clicking in the first link in the description. Don't forget to like, subscribe, and turn on the notifications so you get notified every time I upload a new video. Share this video if you found it helpful. Thank you so much for watching, and I will see you in the next one. Ciao!